Welcome to Conversations with Dr. Jay Harness. And I'm really excited about my guest today. Christopher Fitzmaurice is a clinical exercise physiologist in the Executive Health Concierge Program at the University of Miami. He's certified by the American College of Sports Medicine as a clinical exercise physiologist and a cancer exercise trainer. Christopher holds 2 master's degrees, one in clinical exercise physiology and the other in prevention science. His professional mission is to demonstrate that exercise is medicine and that it should be a foundational component of standard care, particularly for cancer survivors. Chris, welcome. It's great to have you with me today.
It's great to be here, Dr. Harness. Thank you so much for having me.
Well, you're very welcome. You know, Chris, you and I know each other. My mother didn't name me Dr. Harness when I was born, so please call me Jay, okay?
You got it. You got it.
Yeah, great. And you happen to be blessed that you're at a really outstanding university, particularly the Cancer Center there. They've been some of the leaders in the United States and our world of exercise oncology, haven't they?
Oh, absolutely. They're world-class leaders. They're doing incredible and various clinical trials, and I felt blessed being a part of that during that time.
Yeah, you know, you're very fortunate to be there. Tell me about your mission to educate our colleagues in cancer as well as patients.
Absolutely. Well, I mean, just to tell you the truth, I mean, you probably know this as well, but there's just so much good stuff out there. When you actually take the time to really dig through the weeds and everything, there are so many studies and just information out there that many people don't know about. And the fact that I find so much, it's almost like I feel like I have to share it every day. My overall number one mission is to, as with many other people, I want to help to contribute to making exercise the standard of care for everyone, but definitely specifically for our cancer survivors.
Yeah, I'm with you all the way. When I stumbled into all this about 7 years ago, I was just thunderstruck that I didn't know about the science. And then I quickly figured out why, because, and I know you're eventually going to go on and get your PhDs, but it's been outstanding people like you and the people you
Oh,
work
thank
with
you.
there at the University of Miami and others who are PhD researchers in exercise physiology, kinesiology, and sports medicine, who for the last 35 years have generated over 3,000 clinical trials, 25 to 30,000 publications, but those have been primarily in their literature, not crossing over to the general medical literature or the oncology literature. And you're starting to really change that by all the information that you're posting on LinkedIn. So I want to congratulate you.
Wow.
Really.
Well, I didn't. Well, first of all, that means a lot coming from you. Um, I'm just doing the work that I enjoy doing. I had no idea that I was, I guess, changing the landscape. That really means a lot to me.
Oh, you are, my friend. You certainly are. We've got to educate my oncology colleagues, let alone the general public. Chris, one of your focuses is to think of exercise as molecular medicine. You want to share with the audience your thoughts about exercise as molecular medicine?
Yeah, absolutely. So just recently, and I'll even say this: when I did undergrad and graduate school in exercise science, and this was back in 2005 and 2009. I know it's a long time ago, but anyways, never once did I ever hear our muscles is an endocrine organ, ever. And recently, it was discovered that of exerkines, basically, and these various exerkines are released from our muscles when we take the time to move and exercise. And a lot of these different myokines or exerkines, they basically are master switches, as I like to think of it, to activate various hormonal responses in the body, whether it's to counteract inflammation, whether it's to accelerate the burning of fat, also just improving BDNF, brain-derived neurotrophic factor within the brain. All of these like factors all together, just when we move and ever since when I began learning more, and by the way, I'm still at the tip of the iceberg because it's some deep level stuff. But but it's all the information is so fascinating, but it's so complex at the same time.
Yep, no, it sure is. And also with the immune system kicking out
Yes.
killer lymphocytes, macrophages, and other things. So literally, our body is creating our own medicine, isn't it?
Yes, and I always tell people if cancer had a cancer itself, I tell them, I mean, with respect to other various treatments, but just in the context of exercise, exercise is the cancer of cancer itself. It's basically it reverses a lot of the factors that cancer and some of these different treatment regimens does to cancer survivors.
Yep, no, absolutely. Now, one of the things I know you're interested in is called the implementation gap. In other words, we've got all this evidence. I
Yes.
recently wrote an essay called Exercise Oncology From Proof to Practice. What
Yes.
are your thoughts, Chris, about how we can close the implementation gap? We've got the evidence.
Yes.
What are your thoughts, especially when it comes to referrals by physicians to exercise physiologists like yourself?
No, that is $1 million question right there. I wish it was a simple answer, but there are many different factors that are needed to change to improve the implementation gap. For instance, there's we'll just start for one. There's not enough providers, exercise cancer providers. In the world. I mean, even this country alone. I mean, there are some, but there's just not enough in comparison to a lot of the other
Yep,
allied health professionals out there.
yep,
So that's one. Since there's not enough providers out there, essentially there's not enough knowledge knowing how to utilize exercise to benefit cancer survivors. But we're getting better. We're definitely getting better on that. The other one, for example, especially within hospital settings, we are getting better, but exercise is still not the priority.
yeah,
So when it comes to getting that clinical buy-in, when it comes to creating various exercise oncology programs like within the hospitals, that gap is there. Also, just when it comes to the clinician level, oncologists are definitely getting better at this, but there are a lot of them out there that still thinks bed rest is still the answer, or if they do exercise, they don't do it during treatment. They have to wait, I don't know, like several months after post treatment, for example. And now, for example, we have a lot of evidence talking about or discussing how exercise is beneficial through the entire cancer continuum, especially during treatment. So the things that I mentioned there, and there's many others, but if those factors starts to improve better over time, we'll get closer to filling that implementation gap that's out
yep.
there.
No, I'm with you all the way, and we're all working on trying to get reimbursement for this as well.
Right.
Chris, one of the big discussions has been the dose of exercise, and I know that's been a research interest of yours. In other
Mhm.
words, we don't say to patients coming to a medical college, we're just going to give you some chemotherapy. In other words,
Right.
we actually figure out actual dosage depending on weight and height and a variety of things.
Right.
But what are your thoughts about the dose of exercise? The national recommendation is 150 minutes a week of moderate intensity exercise aerobically, along with 2 to 3 days of resistance training. but tell us your thoughts about dosing when it comes to the amount of exercise cancer patients should have.
Absolutely. So just to keep it simple, the when it comes to the regular guidelines for I'm not going to say many, but for certain cancer survivors, achieving the guidelines is perfect for them. But for many other cancer survivors, it's more complex than that, and that's why there's a lot of research out there that talks about microdosing or regulating the exercise prescriptions for them because especially depending on the type of cancer, depending on where they are in the treatment regimen, especially like the same cancer patient who starts prehab may be able to tolerate 30 minutes of walking in comparison to that same person going through their let's say they're receiving chemotherapy as their treatment. They can only do 2 minutes or something like that. Sure. So it not only is a case by cases per se, but it's also a session by session per se, with them. And that's why for example, when I work with cancer survivors, I always tell them to look. I understand that there are going to be certain days that you can't achieve doing the exercise, but always set that intention that you're at least going to do something with the exercise, so that overall the recovery aspect of it is going to work out much better.
Yep. And I know you're a big fan of prehabilitation as well. In other words, before somebody's going to start chemotherapy, getting them moving. It ends up at Maple Tree Cancer Alliance that only about 13 to 14% of the newly diagnosed cancer patients were even exercising on any kind of regular basis. And so getting them just moving before they even start the therapy is important. Any other thoughts about prehab? I know you're a big fan of that.
Yeah, absolutely. A lot of great research and information is coming out of that. And the thing is, prehab is not new, but it's definitely diving deep within the oncology setting, because we're seeing true value of starting the exercise as early as possible, especially when we think of multimodal interventions. Is a lot of the physiological effects that we get from exercise, the stress that we get when we go through a treatment regimen, like such as a surgery. It requires injury, or you're getting those same inflammatory like factors. You're putting a lot of stress on the immune system. So the exercise component, especially in the prehab sense, is vital for those individuals.
Yep. Well, Chris, it's really been a treat having a conversation with you today. Any final wrap-up thoughts you want to share with people?
Absolutely. I feel like we're just only scratching the surface of the iceberg, I can feel some big groundbreaking discoveries in the exercise world is gonna happen here in the next couple of years.
I'm with you all the way. Well, Chris, I want to really thank you for being here with me today. I also want to encourage people to come visit us at cancerfitness.org. We have lots of resources there. And as Chris and I would share with you as we close, please just keep moving.